Welcome back. In our health segment today, Roadmap to Cancer Control in Africa is the theme of the International Conference on Cancer taking place in Marrakesh, Morocco. Africa 54 health correspondent Linord Moudou is attending the conference and now joins us live via phone from Marrakesh. Linord, what's happening today in Marrakesh?
Hello, Vincent. So today the conference, actually the official start of the conference is tomorrow, but today there were a series of workshops and panel discussions, and several topics were on the table, including pediatric cancer and how to address some of the challenges in terms of access to treatment.
Now, we know you've been speaking to people there. Can you give us a little bit more details on who you spoke to today?
Yes, so I spoke to a few people, including first Professor Ahmed El-Zawawi, who is the president of AORTIC. AORTIC is the African Organization for Research and Training in Cancer, which is the organizing group for this conference. And basically, he talked about the fact that the idea of bringing these people together under this conference is to see ways to create better synergy among African countries along with others, non-Africans, to direct efforts for better training and research to help African cancer patients. He also talked about the focus on how to increase affordability of cancer drugs, treatment, management, and palliative care.
Now, we know cancer is becoming a big problem across the continent of Africa. What are some of the specific topics that will be discussed in the coming days, beginning tomorrow?
So there will be many different topics, including basic sciences of cancer. How does cancer develop? Genetics, looking at genetics, how it's being transmitted from parents to their children. Also, telemedicine, how telemedicine is playing a role in remote cancer treatment or remote cancer care. Also looking at chemotherapy, epidemiology, and innovative ways of treating cancers. What is being done by African researchers to also lead the way in finding a better treatment for cancer patients on the continent.
Now, who else is attending this conference besides journalists like yourself and doctors?
Yes, as you said, journalists, doctors, researchers are attending, survivors. I spoke to a male survivor. Believe it or not, there are men that are affected by breast cancer, and I spoke to a male survivor of breast cancer. There are also experts are coming from Africa, but also Europe and America. You have the National Institute of Health from the U.S. That is here, WHO, of course. Several people from WHO are here. So it's really a wide range of backgrounds in terms of knowledge, expertise, and interest. Even companies are here to sell their equipment, cutting-edge equipment in cancer treatment, detection, and control. So it's a really dynamic and diverse group that is here. About 1,000 people are attending this conference in Marrakesh.
Up to this point, what have you heard about the fact that one of the biggest problems in Africa is the lack of doctors, oncologists, people who can help identify and help cure this disease?
It's a serious problem indeed, Vincent, and it's one of the issues that Professor El-Zawawi was mentioning, the fact that they really want to focus on training. Look at this, for example, when it comes to pediatric cancer, some countries don't even have expert pediatric oncologists to take care of children that are affected with cancers. And you have countries that do not have this type of expertise. So yes, it is a serious problem. Training is a serious problem, and this is one of the issues that they hope to address moving forward in terms of improving training with partnerships from the West and other countries.
Linord, thanks a lot for your excellent reporting there. Africa 54 health correspondent Linord Moudou reporting live from Marrakesh in Morocco.